If we look at the evidence included across systematic reviews simply, for example, we can see here that there's a huge variability in this particular figure. And what we find here is that when we look at the individual meta-analysis that's been published, right, on the y-axis, and then we look at the x-axis and we see the total number of randomized trials included, they're highly variable. So in fact, even the systematic reviews and meta-analyses on the topic summarizing the best evidence in viscosupplementation are highly variable in what they include. So it's no wonder that we might be seeing differences across guidelines and recommendations depending on the systematic reviews and data sources they use. And you can see that in and of itself is a challenge. The extent to which we can standardize our approaches or the inclusion of evidence will certainly help us in that regard. Another important thing to do is look at the agree statement itself. And we look at the agree statement itself across these guidelines, you see that there are, again, huge variability in the rigor in which guidelines have been produced based on the agree criteria. So if we apply the agree criteria, we can see that there is variability. Now, many achieve many of them, but there are none that achieve all the criteria as 4 stars, or in this case, green boxes. There are some that have some challenges with respect to red boxes, which are very infrequent use of those particular checklist items.